Welcome to another episode of the Your Company Health Podcast. My name is Andre Wright, and today we have an exciting guest. We have Jessica Toews of Brainvive. Hey, Jessica, good day, and how are you?
Hey, I'm great. It's awesome to be here with you.
Yes, I'm excited to have you on today and to talk about your business. So, to get things going, I want you to tell us your story and how you got involved in healthcare.
Yes, absolutely. Well, I have a history of working with physicians across the country, helping them to get the word out about their practice, helping them write books, maybe launch product lines that they're interested in. So I've always been a part of really an innovative movement across the country of physicians and practitioners who are just thinking outside the box and looking at every resource and tool to bring healing, whether it's to their family, themselves, their child, their community. I believe that there's not just like one linear journey here, that we have to pull in other things to be healthy and to really be able to optimize ourselves. And so during this journey, one of my children actually was struggling with specifically just reading and cognitive focused attention. And we had done so many different things. We had seen so many different practitioners and had really along the way made a lot of progress. And yet by the time he was in second grade, he still couldn't read. And I'm not talking about just traditional dyslexia. He had a processing issue. His brain was really not processing fully what he was seeing. So visual processing, and no one could really tell us kind of a timeline on when he would be reading, how we can increase these processing skills. We just started hearing talk about labels. And while I think that diagnoses can be so helpful, we also have to look and continue searching for ways that we can innovate and really help children and adults who have a label or who have a diagnosis go beyond maybe the potential or what they think is possible. So in my network of communities and physicians that I knew, someone told me about a program out of state, out of Georgia, that could possibly help my son. She had used it with her daughter and had tremendous success along with traditional reading and dyslexia remediation. And so I started to pursue that. And this program was 12 days. And I thought, how in the world am I going to do this out of state? But you know, when a mom is on a mission, we are not going to stop when it means helping our child succeed. And so we went and we did this program. And let me just tell you, his life was radically changed. And so what this program is, and that's the core of what we do now at Brainvive, is it's really neurorehabilitative in the sense that it's working your dominant sensory system. So we're looking at your auditory system, your visual system, and your vestibular system, which is located in your inner ear. And what happens a lot of times is we have a system that maybe is underdeveloped. Maybe there was a delay in our sensory perception and integration in that really pivotal 0 to 3 years of age. Maybe somebody had an accident. My son in particular had a concussion. And a lot of times we go through kind of the concussion protocol, but we don't really know necessarily what's been lost or maybe what potential now is going to be trapped because we've lost a little bit of our integration because of that impact. And so for my son, for example, we went through this program with light, sound, and motion. It's coupling 3 of those dominant systems and really pushing that training and that therapy on all 3 systems at the same time. And what happened was on day 9 of the program, we were driving to his therapy appointment and he began sounding out phonetically what he had been taught and trained in school. And looking at all the signs and the billboards that we were, going down the street, he began trying to read them. And this was the first time he had ever done anything like that. So we knew immediately something was shifting. In the subsequent days and weeks to come, we started seeing him change his social interactions. We started seeing so much more regulation just in his behavior and his emotions, and his hyperactivity shifted greatly, which you can imagine as a mom.
Exciting.
That was welcome. That was really welcome. So we didn't just see the benefit of his eyes really teaming with his brain and the processing, the access to that cranial nerve really seemed to be lit up. Like, wow, he's actually able now to see and process what he's been told and what he knows, from an educational standpoint, from a cognitive standpoint, he could apply it. And so that really became the point where I thought, wow, I'm consulting for these physicians. I'm traveling to the West Coast, to New York. I'm doing all of these things for work, but this is really where my passion lies. And folks on our neighborhood street, at our church community, at the school began asking us, what did you do? Like, what happened? Because this was such a dramatic change for him within that time period. And so I went and got certified in the program, and we brought the program to Atlanta, and we've since expanded upon it. We're doing our own research and we're applying our own methodology, and we're seeing such tremendous results here in Atlanta. So that's really the story. It comes from personal passion, and then deciding that my son's not going to be the only person to benefit from this. I really want to see children and adults alike be able to benefit from training those sensory systems.
Of course, and that sounds like a huge breakthrough. Of how many practices do you have at this point? How many locations?
Yeah, so the exciting news is we have 2 locations right now, located in Peachtree Corners, Norcross in Atlanta, and then also in Buckhead. A statistic that I just looked at the other day was last year we were able to help not just so many people here in Atlanta and families and individuals here in Atlanta, but folks from 19 different states came traveling to Atlanta to one of our locations to do the 12 days in person. And it's really important to do the 12 days in person. A lot of folks will say like, hey, can I just come a couple of times and then come back next month? I wish that were the case, but we're really working at the level of the brainstem where we need to take advantage of neuroplasticity. So we need the 12 days of repetition to really be able to make and forge the most amount of change at the brainstem level. So children come twice a day. They typically come like a morning appointment, and then 3 to 5 hours later, they come again for their second session. So we get to know families, which is so special and so unique kind of in the healthcare industry. So many times like practitioners are just, stressed trying to get everybody in and see people back to back and give quality care, whatever they're doing. And I think one unique factor about Brain5 is we get to see folks twice a day, so 24 times in 12 days. And so we really get to make relationships. We get to make other recommendations, having formally, prior, I think I touched on my experience in other, specialties and getting to work around a lot of talented practitioners. Oftentimes I'm able to say, hey, have you thought of this? Or have you gone, to this physician or to this therapist? If I feel like there's something else that maybe a child or an adult can gain. And so it's just been such a special and unique model for us to be able to help others and affect change. And when we launched, we really thought years ago, like we're going to see so many children, struggling with reading, and folks who have had dyslexia their whole life, and they're wanting to gain greater integration. And actually, do you know that we see just as many adults as we see children now?
Okay.
And reading is just one of the facets one of the reasons people come to us. And so predominantly we see those struggling with anxiety, emotional and behavioral regulation. We see a lot of adults who have had whiplash, because we know that anytime we have, any type of impact to our neck or trauma to our head, it can impact our integration and our perception. And so we see a lot of folks post accidents that have, headaches, dizziness, vertigo. They just don't feel the same as they did before. So we see a lot of folks in that position. And then we see traditional learning challenges where, processing speed, maybe someone has had a full psych ed eval and they're diagnosed with ADHD or ADD or OCD. So we get to really work. There's no 2 days that are the exact same. We get with really just quite an incredible reach of folks. And so it keeps our days really engaging and interesting.
Awesome. And so in terms of it sounds as if you would get a lot of referral from physicians, right?
Yes.
And that could be most of your incoming new patients, correct?
Yes. So to date, we haven't done any like traditional, advertising or marketing, which I love. All of our referrals, folks walking in are referrals coming from practitioners, pediatricians, child psychiatrists, psychologists, even teachers who have said, hey, have you checked out this program? One of my students did this and it was really effective for them. And then of course, just person to person, family to family. And we are incredibly results driven. So it's one family saying, hey, this affected change for us. We gained 20% in this area or 30% in that area. And they tell their friend or their neighbor about it. So a lot of referrals. We're constantly meeting new physicians. We're doing a lot of tours. We have a lot of practitioners who want to just come and learn because they say, my patient wasn't doing this and now they're developmentally doing it. So what happened, and it's really encouraging to make those relationships and connections.
And that's awesome, Jess. And I want to, as you know, I'm in the digital marketing field. So just imagine if you started a big digital marketing campaign, how that could could push the needle if you're already being so successful in that, word of mouth and a referral base,
Yeah, I love to tell our stories, and a lot of folks have told their stories on social media, or they've written up an email to their friends or told a story. And it's really special when we have, especially a child who's maybe they're in a specialized school program and they've been trying to work through reading fluently, comprehension skills. And 30 days later, we'll get a video from that parent and the child is reading a full chapter book. And,
wow.
It's really exciting, not just for the parents, but for us, because we just see tangibly so many cool results.
And that's awesome, man. It's just good to know, and I just can imagine how great you feel to know that you're having that great impact, that of actually changing people's life by what you're doing, and that must be a good feeling.
It is, yes. We've had kind of a onset of college age students coming to us for anxiety. I think post-COVID, so many of those adolescents were at a very pivotal time in high school when they walked through the world shutting down on them, their schooling shutting down, their education kind of going on pause. And so as these adolescents are navigating higher ed and they're in college and the demand and the stress levels are increasing, we've just seen a lot of anxiety in that generation, especially. And it's been really neat to have some of those individuals who've had to maybe come home back to Atlanta, take a pause, take a gap year because they're not really coping well with the stress of life. And a lot of times they will just say, I just feel off. I can't get out of bed. I feel depressed. They're seeing a psychiatrist or a psychologist and getting great therapy. And they come to us and we're able to help expand their visual fields through our specialized light therapy. We can integrate their auditory system and help their auditory system perform and just make it more integrated as well as efficient. And then we're working on their vestibular system, which so many times by illness, inflammation, just activity exposure, they're very, they just feel dysregulated. And so when they can come and do the program and then they're able to get a job, they're able to go back into school, they're able to do classes remotely again. It is really satisfying because, while that may seem temporal or okay, so you just help them with their anxiety, like that could be their whole future, that they're trying to get that degree. Yeah, they're trying to, make relationships and connections and be able to have confidence again and network again. And so, yes, it's very exciting to see the changes, not just for the little ones, but, for the older population as well.
And Jess, it's obvious by just listening to you and doing the research, you're very successful in terms of you scaling your operations. But talk to us about some of the challenges at this point.
Sure. So I think one of the challenges is just helping people understand something that's so nuanced and so unique. We're not a medication, which is widely accepted in the medical world for some of the things I've spoken about. We're not a traditional therapy where you're just going for auditory therapy or you're just going for vision therapy or simply going for occupational or physical therapy. We're really blending all of these unique pieces together because that's how our brain wants to work. And so helping folks just understand the basis. I actually had the opportunity to speak with a brain expert, Dr. Daniel Amen, and he's a well-known worldwide psychiatrist, very famous, and has a lot of success with his patients. And when I spoke with him about the program, because one of his patients became a BrainVive community member by coming through the program with great success, he said, well, for me, a person who has studied the brain as a physician, really my whole adult life, this makes a lot of sense. And I felt so validated in that moment. So I think it's helping folks just understand how our dominant sensory systems work, how we have to have this perception. If we have a lot of stimulation coming at us at one point in time, and our brain is trying to perceive everything, and there's a gap in that perception, how in the world would we be able to integrate that information to have reasoning skills, short and long-term memory, working memory, just cognition in general and coordination in general. So it's really helping, I think, a challenge, or maybe, you just said what's something that has been, climbing that uphill here in Atlanta, is just helping the people understand and educating people on how our systems work and that we can train them to make them better. 30 years ago, neuroplasticity hadn't been proven. So folks thought,
Yeah,
hey,
that's
once
true.
there's a developmental gap, or I mean, even as recent as 20 years, we've come so far in our information and knowledge of the brain. And so, the belief was, once somebody's developmentally delayed or stunted or challenged, or there's an accident and you've lost some cognitive function or coordination skills, that's it. Like, kind of just, that's it. And we know that's not the truth. We know that there's so much potential that can be unlocked. I mean, you look at people who maybe lose function of their hands, and suddenly they're learning after years, they can write with their toes, or they can paint with their holding the paintbrush in their mouth. I mean, we are able to make so much more progress than I think we give ourselves credit for. So yeah, that would probably be something I would say has just been, so unique to us, is just kind of getting the word out and educating folks more. The
Mhm.
other thing is just the sheer nature of our business, the repetition that I mentioned that's involved. Working around people's schedules can be really challenging, and so finding the right time where they can come in and do 12 days of this intensive training sometimes can be tricky when you have kids at school, parents who work full time, multiple kids in the house. So oftentimes our busiest season tends to be right now, during the summer stretch, when folks have a little bit more bandwidth, their employer maybe is a little more flexible with them, and the kids don't have the demand of school and activities like they do during the school year. Our other busiest time of the year, which I would say maybe is a challenge for us personally, is it's around the holidays. And so really from kind of Thanksgiving through the first of the year, we are packed. And so this
Imagine.
balance work life with I'm a mom of 3, and so my husband Chris and I try our best to be extremely present with them at all of their activities, and we want to be around family during the holidays too. So just juggling all of that as a business owner.
Okay.
And
Mhm. But just talk to us about your process.
so they come in for 12 days. First, we start with an evaluation. We want to get data points and a baseline for how these 3 dominant systems are really performing. Typically, that's for children who are 5 and older, all the way up through adults. We do this evaluation. It takes about 90 minutes, and that really determines candidacy. If an individual cannot do the evaluation because they're younger than 5, or cognitively they're unable to communicate or do the evaluation, then we have an adult and an adolescent extensive survey that we provide that helps us get to know the individual a little bit more based on the parent or the caregiver's observations. And so that's really the first step of our process. And then once we determine if an individual is a good candidate for the program, we really want folks who are going to get gains from this program. They're going to get a shift, a leap forward in their development or their abilities. And so once we see if an individual is a candidate, then we look at scheduling their 12 days. And so it really just depends on when we have availability and when that individual is in town for 12 days and can make all of their appointments. And then we go from there. And it's pretty smooth. Once we start going, everyone knows the rhythm, and we just begin to see those families come in through the door 12 days in a row.
And just, I know insurance companies could be a pain. So do you take insurance?
We do not. And I wish that we could take insurance for so many reasons, just being able to help more individuals afford the program. But we do not at this point in time take insurance. What we do have, though, is flexible spending. Many people will use like their HSA, FSA accounts. And so a lot of folks take advantage of that. But we do not at this time accept insurance.
Mm. Yeah, I mean, at the end of the day, based on what I've seen and what you're explaining, it's a very successful program. So it's an investment.
Yes, absolutely.
Talk to us about. I know you've been in healthcare for a while. You're working with physicians, you have been working with physicians extensively. Talk to us about some of the mistakes you've seen healthcare practitioners make in terms of like growing their business.
Yes. So I would say probably the top one I've seen is folks who have experienced a lot of growth and they're not necessarily working as much of their time on the details any longer because maybe their schedule has increased and become extremely demanding. And so we're looking at kind of a concern over quality. You've got this high quantity of patients coming in and you're growing, you're onboarding, new physicians or nurse practitioners, and we're slipping on the quality standpoint and the detail standpoint. And so I think one of the greatest things that a practice manager, director of that practice can do is just implementing really good systems. Because the system that you had to, run a healthcare practice with 2 physicians on the books, it looks very different than when you have 12 physicians or practitioners. And so I think, as you're growing, not just being worried about, people coming in the door, do I have enough folks to do lab draws? Do I have enough folks to do triage? Do I have enough folks to make the appointments? But what are those systems looking like that need to grow and shift with the practice so that the details are taken care of? So the prescriptions are called in right, the follow-up calls are called in, properly and in a timely manner. We have clear communication with our patients on accessing perhaps their online portal, et cetera. And so one of the greatest things I think, can avoid so many mistakes if there's clear systems that are growing with the practice numbers.
And you're spot on. You're spot on because as you know, I'm in the digital marketing field, and some of my clients at times we will send them leads, and new patients will be calling. Their receptionist may not be answering the phone, and so patient's experience is very important. Having the systems in place to ensure that from day one, the prospective patient would just have a good experience until when the practitioner will provide that service. So you're totally right. Moving away from that can definitely create a bad taste in patients.
Absolutely. And I think we have to view healthcare as we view every other business, right? We're offering a service. And even if the individual is, the physician is fully in network and the practice is, an insurance-based network, I think what oftentimes we, on the inside, I'm speaking as if I was in a practice, we forget that even though the patient is paying the insurance fees and the insurance is covering the appointment, we're still looked at as the practice as the one service, right? We're still looked at the one that's held responsible. They're not thinking about, who's paying the bill, so to speak. And I think it's really helpful when the leader of the practice, the physician who owns the practice, whomever's in leadership there, really drives home that we are in a service-based industry, right? And we need to make sure that our customer or our patient is always feeling like we're proactive with them, especially with our healthcare. I mean, even more so than going for like fine dining or when you go to like a fancy place to vacation. I mean, your health is the most important thing that you have, right? And so making sure that, that you're delivering on that service is just a really easy way to get great physician reviews, referrals, growing your practice. And it's just the right thing to do by people, especially when you're talking about something so sensitive as their health. I think one of the greatest things that some of the practices I consulted for and worked closely with, when we focused on each person every time, they're not just a number, they're not just the next appointment, they're not my 10 o'clock or my 10:10 or my 10:20. This is each person every time matters so much. We saw a lot of, the online chatter about certain practices diminish, a lot of the frustrations about things diminish. It's incredible when you really just treat people like you would treat your own family, how much it can impact, just the entire practice at every level.
No, you're spot on, and reviews are so important because I know if I'm searching for a practitioner in a specific area, I'm gonna go look them up and look at the reviews.
Right.
And patients will go there and write bad reviews for these practitioners. So it's so important to give them the best experience.
Yes, mouth is also free marketing, and so when you are
Yes.
treating with, just so much respect and so much care. When someone's looking for a family doctor, or they're looking for, some type of therapy, and they say like, hey, not only did I get good results by going to this physician, but they were wonderful. Like, they really care about my family. That goes such a long, long way versus just like a billboard in the sky. Both are important, right? But you really need to be able to back up that billboard, what you're saying on that billboard with what you're delivering. So yeah, I'm really passionate, as you can tell, about experience and service. I think in this day and age, it's just there's such high expectations from customers or patients alike. And we all have access to the digital, kind of vent sessions on review.
No, I mean, you're completely right. And, it's all about, giving that great experience. But Jess, I want to, let's talk about the state of healthcare. This may not really impact your area, but what I realized with even some of my doctors, you have these private equity firms and also like DSOs when it comes to dentists. They're going around and buying up all these smaller practices. What are your thoughts on that? And how the healthcare is changing?
I think we need like 5 podcasts, honestly, to unpack that. But I will say that, my fear is being somebody who really thinks that medicine requires relationship, and healthcare in general, whether it's a therapy or it's actual medicine, requires a relationship to really understand your patient. My fear is that we're starting to lose some of that connectedness that makes physicians and therapists so successful with their patients, because they're not just looking at a patient as just a number and really just like lab values. They're listening to their lived experience. They're putting all the history together, and they're making, sometimes gut decisions on a patient's care that can impact, their disease outcome. And so I believe, and I feel strongly that as this is really becoming more and more, money driven. I think that these purchases, if we lose the relationship piece of healthcare, I think we're missing the mark. And I think we're going to regret it in generations to come. We may not see it immediately. Sometimes I think we do, but I definitely believe that in subsequent generations, we're going to say, why did we do this? Like, at what cost are we really paying? And I think the cost is human life. I think the cost is a healthy community, a healthy, really nation. And so I am concerned about the state of healthcare. I don't have a great, answer for you on how to fix it. But I do think that if, physicians who are going into medicine and practitioners who are already practicing, really push back on, hey, I have to have this amount of time with each patient. Like I was, one of the practices that I was consulting for out west before I started BrainVive, they were being asked by, the folks who had bought them to reduce their patient time 6 to 7 minutes per patient.
Wow.
If I'm in that position and I'm the patient, I don't want you making massive decisions on, what medications I'm taking, what surgeries or therapies I should be having in 6 to 7 minutes. I just don't know if that's a great idea. So yeah, I think just for physicians and practitioners to continue pushing relationship and pushing quality over quantity is gonna be huge in the coming years.
And I totally agree. And that's my takeaway from all that, is that it's definitely going to impact the patient experience. It's all going to be about numbers and then less about it's good, and not enough emphasis would be placed on, the patient's, health and well-being versus just all about a number, and making that buck. So I completely agree with you on that. And just, I know we're at the end. I know we've been speaking for a while, but I want to switch gears a little bit. If you could say, always ask guests this: what was the best advice you've received, and how is that impacting you now in terms of in business?
In business, well, as an entrepreneur, I think the best advice that I was given is don't judge your success on your highest highs or your lowest lows. Like, always try to kind of be in this middle of the entrepreneur wave. We have, incredible moments. And then we have moments where maybe we're missing one of our kids' baseball games, or we're having to sacrifice traveling over the holidays, to be with other family members because of what we believe in and what we're doing. And so I think a more seasoned entrepreneur told me, hey, you're going to have some high highs and you're going to have some low lows in this.
Yep.
And learn to kind of modulate yourself in the middle somehow, you will last a lot longer. And I think that that's the greatest advice on this journey to date that I've received. And I think it's also a great way to approach life, whether it's parenting,
it is,
whether it's singlehood journey, whatever it is there's going to be high highs and low lows, whatever we do. And somehow giving yourself that perspective to step back and realize, like, things are not, always that bad, or this is a great moment, but tomorrow may not be as great. And I'm still going to put right foot in front of left. So
that's excellent. Excellent advice. And just for people who are listening and watching, how can they reach you?
Yeah, the best way is BrainVive's website. So it's just brainvive.com. Vive is life. So VIVE is how you spell that. It's all one word. And we've got contact form if somebody wants to just send us an email, ask some questions, and connect that way, or obviously, our phone number, and you can reach us as well. So we love connecting. We're also on Instagram at BrainViveATL. A lot of times folks will send us, just a DM asking us questions, logistics, when can I get an appointment, that sort of thing. So any of those ways are great.
Awesome. Awesome. And Jess, thank you so much again for joining us today. We thoroughly enjoyed the conversation. I enjoyed it, and I learned a lot about BrainVive, and I'll definitely talk to you soon.
All right. Sounds good. Thanks for having me.
Thank you.